Well, good morning, everybody. I am so excited that you were able to join us, both those who are in person and those who are online, to our Bridges Transition Conference. This is an exciting time to be back in person for some of us. This is a conference that we've been holding for providers and families for quite a while at Children's, but related to COVID, we had a downturn where we had to do this virtual, so it's nice to be back in person. As we start, I wanted just to share one quick slide with you right here. And this is a picture of the Roberto Clemente Bridge. And we know that Pittsburgh is full of bridges. And I want to show this because I think that as we start this conference, it's always important to think about our why. Why are we here today? And I know a lot of us probably came for different reasons. For some of us as providers, we may be really feeling the need to learn more, to think about how can we do a better job helping our young adults move into the adult world. For some of us as families and as self-advocates, we just want to learn how to navigate this road. But I want us to focus our why thinking about this bridge. And we will talk about the importance of bridges probably throughout this conference, of how do we build a good bridge? How do we start this journey and go on this journey from pediatric to adult care? But I want to start with a story. I was on this bridge about 3 years ago during the summer of 2020, in the midst of COVID, right? And on that bridge, there were a couple thousand people. And the reason why we were on that bridge is that there was this need to stand up against the murder of a young man, George Floyd. And one of the things that was stated over and over again was the statement, no justice, no peace. No justice, no peace. And I want us to use that as a framework to think about why are we here today. So when I think about the word justice, a theologian, Cornel West, said that justice is what love looks like in public. So how do we love people in public? What does it look like to think about equity, to care for everybody in our community? In peace comes from a more ancient word, a Hebrew word of shalom. And shalom doesn't mean the absence of conflict. Shalom means wholeness. And so when we think about this idea of equity and wholeness as a community, we have to think about how do we care for everybody? How do we include and value everybody? And that is really what transition is all about. Transition is the recognition that as young adults, we all have different challenges that are interacting with our lives. Challenges that can lead to the inability to get to adulthood in a successful way. And what we're talking about is how do we build a bridge so that every single one of our young adults moves into adulthood in the way in which the fullness of who they are can be expressed. So when we think about transition, the importance of it is valuing every single person in the room and thinking about how can we make sure that they successfully get there. And so as we think about our why for today, while we're going to be talking about all these different pieces, these technical things, really should center on how do we value our young adults and we make sure that they are the ones lifted up, centered, and think about how they can successfully show who they are as an adult. So I just want to be able to encourage you and say that is going to be our why today. How do we center our young adults and value them? Now we have the opportunity, I'm going to hand it over to Arvin to think about, our welcome for this conference, and we have a special guest who is going to be welcoming us all and just inviting us into this time at Children's Hospital.
Thanks, Andy, for kicking us off. And I'm Arvind Hoskapal. I'm a cardiologist. I take care of adults with congenital heart disease. So this conference is near and dear to my heart, no pun intended. But I have the great pleasure of introducing our next speaker, who's going to be delivering some opening remarks. It's Dr. Diane Hupp. She's the president of the UPMC Children's Hospital of Pittsburgh. And prior to this, she's worked for more than 30 years at the Children's Hospital, and she's synonymous with what our Children's Hospital stands for. One of my favorite memories of Diane is when the pandemic hit. I was going to go get my N95 mask, and she was there, boots on the ground. She was a chief nursing officer back then, handing out masks and being there in the front lines, leading us through the pandemic. So with no further ado, Diane Hupp.
Thank you very much. And it is good to say that we're well beyond those pandemic days. They were something. But as Dr. Arvind said, my name's Diane Hupp, and I have the privilege of serving as the president here at UPMC Children's Hospital of Pittsburgh. I have spent my career here. And when I think back, majority of those years, I'm still a nurse. I'll always be a nurse. But as a young nurse, I do have fond memories of our young adults that needed transitioned. And I want to start with a huge thank you to these two physicians here, Dr. McCormick, Dr. Arvind Hoskapal. We thank you for your purpose and your passion and getting us all together here. There are a lot of other individuals in this room who I know spend a lot of time, a lot of energy. I mean, I look at Bev only because Bev's one of the ones I've known for so long as a nurse herself. And from when I first met Bev, and this goes back decades, her purpose and passion is to help better transition. You know, she works in the transplant world, as many of you know, but is to help transition our young adults to continue to have a seamless transition in their healthcare and their journey of life. So in my years here, just a few brief messages. First and foremost, a huge welcome. You know, beyond my thanks and gratitude for taking out your Saturday morning, I want to give you a heartfelt welcome. Whether you're a patient, whether you're a provider, a guest, an advocate for this important work, we thank you. This takes time, it takes dedication, and it takes, I believe, a different way of thinking. Children's Hospital mission has always been to take care of all. Our mission is to take care of not just infants and babies and young children, but young adults and even adults that aren't so young. When we think of young adults, we think of those maybe in their upper teens and 20s. We know that Children's Hospital takes excellent care of adults for some special diagnosis. But we also know that there comes a point in time where it's right to begin transitions. I love the picture of the bridge. When I look at the bridge and when I think of the word bridge, I think of connections. I think of endings and I think of beginnings and all of what's in between. And I'm sure today, those here and our experts that are going to speak to some of the endings, the challenges, and the challenges with new beginnings. We all go through changes in our life and transitions in our life, whether they're personal or whether they're professional. They all bring about challenges. But they also bring about, I believe, a level of hope and opening new doors. So my hope today is that, number one, that we're increasing the awareness of this very important work that each of you do every day. I think number two, I'm most certain that you'll discuss a lot of the challenges. And finally, number three is, with those challenges, how can we work through them? How can we resolve them? Our job here, whatever role you play at Children's Hospital of Pittsburgh, is to improve the lives of our children, our young adults, and our families. We know that to do that, it takes all of us. It's a multidisciplinary approach. When I look in the room today, and I not only see some patients and families, but I see physicians, nurses, social workers, support staff, different providers. It takes every one of us and a superior multidisciplinary team to make that happen. I do believe here at Children's that we do a good job at transitioning. We've been working on it, but the opportunity is still there to get us up to the great job every time for every patient that needs transitioned. And that's really why we're here today. So our commitment to you on behalf of Children's Hospital is that we're here to support. I, as the hospital leader, certainly want to support this important initiative. And that's why when asked to say, can you take a few minutes just to come to give a warm welcome, I said, for sure, it is important work. You are all valued, you're appreciated, and thank you for your focus. I want to end by saying, if there's anything I can personally do to help as you go through your morning and you end your morning, and I'm sure there'll be some next steps and some action items and focus steps, if there's anything I can personally do to help to bring this to the next level and to reach the next level with our children, our young adults, and our families, to get them to feeling really good about the transitions. I know that our leaders here today will let me know, because I want to help in that way. So with that, I wish you a wonderful morning. Enjoy yourselves. Networking is always part of one of the best things when you get to conferences. We have a nice group here in the room. I thank all of those of you. I know there's a large crowd that's dialed in virtually, and just hope you enjoy yourselves this morning. And thanks for giving me the opportunity to say hello and thank you and offer you a warm welcome. Enjoy. Thanks.
Well, I'm excited for us to be able to get started on this journey together around transition. And Dr. Hupp, thank you for those kind and warming words. And I love that image of a starting point and an ending point with transition. When we think about transition, transition is the purposeful and planned process to move to adulthood. And so we are going to have this first session, and it's going to have three different components where we're going to think about kind of the core elements of successful transition. But really what we're looking at is different perspectives from stakeholders. We're going to have a talk from Bev Kosmach, who was already introduced by Diane, who is a great champion of transition here at Children's Hospital. I know Bev for a long time, working on the transition task force here, but she's actually a national leader as well, as she chairs the transition task force for the American Society of Transplant, which is an amazing amount of work. And they recently just published guidelines about how they are nationally going to think about transition for individuals with transplants. So we get to hear from her great experience as a pediatric perspective, but we also have the other side. If we had that being the on-ramp, we have the off-ramp too, as we have Dr. Kristen Ehrenberger here from the Progressive Evaluation and Referral Center, which is a landing place clinic in the adult world for individuals with complex healthcare needs from childhood moving into adulthood. And then finally, we're going to round it out by having a special guest who is going to be talking about his own experience walking through the healthcare system. And Arvin's going to be introducing him a little bit later. But I'm going to first invite Bev to the stage, followed by Kristen, to talk about what does transition look like from these different stakeholder perspectives.
Thank you for that introduction, and thanks for inviting me to speak today. After your beautiful introduction, Andy, about the bridges, I'd like to kind of start again and reframe my talk, but I'm going to start with a little story myself, and that just in getting involved in transition, I think I owe that from, I became involved because of my patients and because of my families, and I was pulled into it. So I remember the time when we started out in small bowel transplant, which was a very rare procedure with, in the early days, a survival of barely 20% in the first year. And a mother said to me, "How am I going to toilet train my child?" And I'm thinking, well, we're hoping we'll get him to 2 or 3. And then this patient will get to be that old. And then the next question would be, can my child go to school? And I never thought about that. Well, maybe they can, but let's see what we can do about trying to make the school work for them. So they pulled me into helping them get involved in school and preparing them for school and understanding about their condition and that they had a transplant and they had to take meds twice a day. And then it would lead into my favorite one was, Bev, I need for you to write a letter for my doctor, and they wanted it for the school system as well as for some other things. And I said, yeah, what would that be on? And she said, well, my daughter can't drive a car. And I said, why would that be? And she said, well, she has an intestine transplant. And I said, oh, good luck, good try, Mom. It is a scary time to have a young adult, a teen learn how to drive, but no, she's fine, she can drive a car. And we went from that with some of my patients to wanting to do a semester in Japan, and how can we work that? So I have been engaged, and I really am passionate about transition, but I owe it all to my patients and families who've pulled me along with them. And I've learned how our team can help them and support them in doing everything that they want to do as young adults and give them all those opportunities. So with that said, I would I would like to be giving you today a practical approach. So the providers in here, hopefully you'll come out from this with how can I establish a program? And I think the most important thing to do is do something. Talk about it a lot, talk to your patients and your families, and do something. I'll be talking about a few interventions, those that are supported by the GOT Transition Group. And then at the end, I'm going to briefly talk about our program and what we've accomplished. There's not a lot of time to do a review of literature, but I do really want to talk about this one paper that I think applies to everybody who's transitioning patients. And this is done by a nephrology group, Dr. Quinn et al. And they, this paper really guided our program in developing our transition program called My Path, as well as the GOT transition guidelines. It's a qualitative assessment, and it looked at renal transplant patients who were transferred to adult care. After they were transferred, they participated in a qualitative study, and they grouped the patients by if their graft was stable or unstable. So obviously with stable function, their kidneys were working well, they were coming to clinic, they were getting their labs. And the unstable group was a group of patients that perhaps were lost to follow-up, were missing labs. They had a GFR that was greater than a 50% decrease during that period of transition, those sorts of things. So when they looked at the qualitative assessment of these two groups, the patients who were stable with their kidney graft had a greater confidence in their adult team. And this was 70% to 40% in assessing their outcomes. And the themes that came up were those of trust. They felt they had a personal referral to that adult person, and they were aware that the pediatric and the adult team had a relationship, and they saw that there was steady communication between both teams. And unfortunately, the unstable group felt that there was a lack of understanding of even why their care was being transitioned. They were frustrated with the process, and they felt abandoned. Themes that, if you look in the literature, you hear a lot about this from the teens and the young adults. So Dr. Quinn and her group felt that confidence in and connection to this entire healthcare team could be predictive factors in helping them adapt to adult care. And another important thing is, although we're all about knowledge and skill building, perhaps the role of the interdependence between the teams and that trust in going from pediatric to adult care is perhaps the key to all of this. So in considering all of our role changes, for those of you who are teens and young adults in here and the providers, we all go through a role change with this, and I find this to be very difficult. So we go from a pediatric provider having the major responsibility to becoming a resource, the parents who are the primary caregivers now becoming a consultant in care, and think of how difficult that is for some of you who are parents in here, stepping back. And most importantly, the youth who's passive in their care, receiving care all these years, has to develop into being the supervisor or the CEO of their care. This graphic was designed by the prior Good to Go program at Sick Kids in Toronto. And I use this all the time when I talk to my families to explain to them what our goal is. And with respect to the Good to Go program, I'd also like to add the adult provider on this, because transition doesn't end at transfer, but it's a continuation into adult care as that emerging adult matures into their executive functioning skills. And these are things that Dr. Ehrenberger is going to talk about next. So for all of you in the audience, I think many of you may already know about the fabulous website called GOT Transition. It's a federally funded national resource center on healthcare transition with the aim to improve transition from pediatric to adult healthcare through the use of evidence-driven strategies. And there are many resources here. If you are just starting to build a program, look at this first. There's no reason to reinvent the wheel. Use their tools, adapt them to your practice. They have a wonderful family toolkit that I would advise all the families in here and listening online to download. It's about 30 pages. It has questionnaires. It has ways to think through the algorithm of helping your child take on more responsibility. And for the young adult and the teen, it helps them think through what skills they need. So for instance, this is an example of what GOT Transition advises the youth to be doing through their years, questions they should be asking that their provider, and also skills that they may be seeing that they can do. There's a similar one for the parent caregiver. Also, there are many resources on the site for youth with developmental or intellectual disabilities to help them engage in their care to the best of their ability. And one tool that I really like a lot is this Charting the Life course that a parent can do with their child, or you can do as an interview when you're doing your transition session. And it helps the parent and teen decide together what decision-making processes are needed. So there are 6 different areas, daily living and healthy living, you see here. And then the youth can decide with the parent, depending on their level, their cognitive level, if no extra support is needed in helping them transition, or if they need some support, or if they're fine and they can do it themselves. So within these 6 areas, there's some things they could probably do capably, but others that they might need help with. So the foundation of GOT transition is the 6 core elements, which help the healthcare team develop the timeline for transition and provides recommendations and strategies. So I'm going to review each of these steps, pointing out strategies for providers who are starting a program, and also giving families and the teens some ideas of what they can do. There are so many things to be done within this framework of the 6 core elements. And I would strongly recommend that you look at the handbook that's on their website. And it's very comprehensive, and you think, I can never do that. I don't have the resources or the time, but you can do bits of it. They'll give you bullet points and think, you know, the best advice I got from Dr. Miriam Kaufman out of Sick Kids in Toronto, who built the Good to Go program, was just do something and talk about it all the time. And I always think about that, because the more you talk about it, the more you get people interested. And I can say when I first started talking about it in my practice, usually the moms would burst into tears, the kids would curl up in a ball like I'm not going anywhere, and then they wouldn't collaborate with us. But now, because we talk about it constantly, from the time I evaluate a 6-month-old baby with biliary atresia to whenever we get them over to the adult side, it's part of their care, and they're seeing it as part of their care. So the first core element is developing a transition and care policy. So this formalizes the approach. And so you think, oh, policy development, and this kind of sounds boring, but I have found this to be really important because it validates your program. You're talking about what you need to do and how you're going to do it in very simple terms. The youth should be able to read this and say, oh, that's me. And now they're going to help me do this and this and this. And the parent should be able to read it and say, we have support from our team to help us do this process, which is challenging and scary at the beginning. It also helps to define what your team will do and what each of their roles will be. And in doing that, you try to have definite plans within your department that everybody's doing the same thing. Tracking and monitoring is a bit of the business part of it to set up at the beginning. So you need to establish the criteria and the process for doing this, and it'll be different with every division, every department, maybe within a department. Like for us, this is a little different between liver, what I do in intestine, and what the kidney program is going to be doing. You need to determine what tracking information is important for you to follow. I always think to keep it simple, you don't need everything. You need what's most critical in your practice. A little bit about the patient's clinical status, and most important, their psychosocial issues and concerns. And I could go into this for another full presentation about how the youth should be presenting themselves. What name do they like to be called? What's their favorite name to be called? What we do something in our meet and greet where we ask the youth to talk about something about themselves that is not medical. And I can tell you that's the best part of our assessment, and it's how you get to know them a little bit better. And then probably one of the most difficult parts of this for the providers is, how do we monitor our progress? So there are a variety of checklists and templates on the GOT transition site to help you work on this, but you have to monitor where you're going through the system and how well you're doing, so that every stakeholder in this knows where we're at. The main thing is to just get an outline for what you do, and then work with your EMR and your team for how we can effectively get all that information passed through. So for right now in our program, we're enrolling everybody at the age of 13 into MyPath. We have a structured program. We still have plenty of work to do, but we're making a lot of progress in our educational and skill building part. And then when they get to 18, we prioritize them into our fast track. There's lots of challenges. That's again another talk, but we take those as they come. And right now I'm keeping track on a flow sheet, but hopefully this will be involved with the EMR, particularly when we transfer over to Epic in the future. The next core element is transition readiness. This GOT transition recommends that you look at that you use a standardized tool that's going to assess the skills of the youth. There are lots of different tools out there that are validated. So I think you choose what's best for you, what you think you can get through in a clinic session. And you use this so that you understand where your patient is at, and it also helps the youth and the caregivers know. I'll have a parent that's saying, "I thought they could fill up their med container," whereas the teen is telling me, "I struggle with that. I really still need help with doing it." So we're in our department. We're using the pediatric transition portal at AST. This is on for all solid organ transplants, but I would recommend that you look at this on our website from AST, because we created it as a template and it really could be adapted to any chronic condition. The main questions are there. We have 11 domains of functioning, and we do a qualitative assessment as well as a checklist to assess outcomes. Transition planning is the busiest of the core elements. This is when they're hitting that 18 years of age or your top age, and when you're trying to get them ready to go over. So you need a routine readiness assessment. You need to update their goals. We start a medical summary, and you can add on to that every time you see them. You have to determine if there are any decision-making supports that are needed with any legal documents that might be needed on the adult side. One of the more difficult things is to confirm resources, because it's a bit different on the adult side. I know that Dr. Ehrenberger will talk about how plugged in everyone is within her group, which is incredible. But I transfer to a lot of centers that have only transplant hepatology or only transplant GI, and I don't have a social worker and psych and the other parts of the multidisciplinary team. And sometimes after the age of 18 or 21, it becomes incredibly difficult to get resources. We need the youth's consent for release of medical records and then plan for timing. So I would say that during this planning stage, what has helped us the most is that we have totally redesigned our annual transplant clinic, so that now, rather than just let's look at how you're doing from the transplant standpoint, we're looking at various dimensions of our patient's health. So our patients participate in individual sessions with each of the providers that you see here. I do a separate session on transition with them, but they also meet with the other providers who talk about transition. We're on the same page, and then in talking about transition and how we're going to do that. And then in addition, we have meeting every Friday where we review the patients we saw and we reach a consensus about where they are in transition and how we can get them to adult care. This is just a graphic of our overall plan. So we do a readiness assessment, and then it's assessment, intervening, and reassess as they go from 13 to 18 or so. We see them in clinic. We have various learning modules. This is under development, but we have a good start. We work on skill building. How do I make an appointment? How do I call in for refills or do that online? We have peer support through our transplant camp and also through our adolescent group Encore, with the patients are encouraged to attend. They have quarterly meetings. And then when they get to be 18, we prioritize, as I said, in our fast track program. And then for transfer of care, you want to make sure that at that point, your patient is stable and ready for transfer. And for the teens, you have to be sure that you really feel that you're ready. You're going to be a little bit nervous. It's a change, but as long as you feel that you're ready to do the basics, we can get you over there with support. Transfer checklists are very important during this time to make sure you do everything so that the adult side has all the tools they need to help make this successful. There are, again, various templates on this in GOT Transition. And then communication with the adult team is really important. We have a routine meeting the last Wednesday of every month and go through all of our patients that are on the queue. And as I mentioned earlier, we have our virtual meet and greet. And then finally, we're at transfer completion. And this sounds silly to say, but you need to confirm that they transferred and actually were at the first appointment. We have a member of our team that goes to that first adult appointment for our patients that are on the adult side. But when they go to an outside center, we make a phone call and we are sure that they attended. And then you want to continue to nurture that collaborative relationship with the adult team. So now in pediatrics, we become a consultant, but we want to obtain feedback from how we can do that better, and then assess the patient outcomes and all the stakeholder perspectives. So very briefly to conclude, I'd like to talk about some the overall results of our program. We've been doing this for about 3 years now, and I'm going to speak to the patients that we have sent over to the adult side through our program. So we have outcomes data available for up to 2 years. The average is about a year. We've had 35 liver transplant patients who have gone to adult care within UPMC. A little more than half are male, and the mean age at transfer is 27, which I know sounds incredibly old, but we have a large population of metabolic patients who get transplanted at a later age, and we keep them for 3 years after surgery. And this also reflects the backlog of patients we had that needed to get to adult care. We had full participation of all 35 patients. They were involved in the MyPath sessions. They had a virtual meet and greet, and they all attended their first clinic appointment, and most with a support person. Almost all of them have had stable or baseline liver function tests with no significant comorbidities. Our adherence is quite good. This MLVI is a standard deviation of the tacrolimus level, which is our primary immunosuppressive med. The value you want to see is 2 or less. So over half of them had an MLVI of less than 2. We were pleased about that, with a mean of 1.75. Adherence with labs was roughly 70%. One area that we need to improve is about 70% attended their first clinic after the transfer. So this is at 12 months after transfer. We had some no-shows, which was upsetting. They should have at least called to reschedule, but we're working on that. The subjective comments of the coordinators are that most of them are maintaining routine contact and calling appropriately for what they need or if they have issues. The new onset comorbidities are minimal, so this was a very stable group. We did see 2 episodes of rejection due to non-adherence, and then some issues that you would also expect in an older patient, long-term immunosuppression, and as young adults with some hypertension, hyperlipidemia, and GI issues, which was mostly GERD. And we've had 3 pregnancies after transfer, which I'm very happy about. We've had 2 live births with 2 little baby girls who are healthy, and we have another mom who will be delivering in November. And another really good advantage of this is that these patients are now going for preconception counseling with the maternal fetal program at McGee. So in conclusion, all the young adults in this group are medically stable, as I just showed. Most are communicating appropriately with their coordinator. However, we're starting to see some deficits in self-care, particularly with the labs and the follow-up, which really has to do with executive functioning, as these young people are still in the emerging adult phase. And it affects their ability to fully plan and organize. So when you say get labs, they can say, sure, I'll get labs, but there are a lot of things to do to be able to get to sit in that chair to have your labs drawn on Thursday morning at 7:30, right? So in response to that, we're doing more targeted education on labs and follow-up during the transition session, and the adult side is also engaging more with frequent contact after transfer, reminder calls, and emails. So we're seeing that a partnership between the youth, the parents, the pediatric providers, and the adult providers through a structured program that supports this continued transition into adult care may promote stability and maintain healthy outcomes. We have a long way to go, but I think we have a good first start. So of course, the young adult perspective as transition is warranted. We just got funding to do a couple focus groups this summer, so I'm very excited about talking to the teens about their experience. And I'm hoping that through these discussions, that we see them reflecting that they have a confidence in our teams, a sense of trust, and effective communication and collaboration that's helping them succeed in the transition to the adult providers. Thank you.